Well, we've talked many times on this show how Botox can help give you a wrinkle-free forehead, but what about pain behind your forehead? You'd be surprised to know the medicinal uses of Botox. Here to explain more is neurologist Dr. Martin Taylor with OrthoNeuro. Welcome, doctor. Thanks for joining us.
Appreciate it.
So I remember way back when Botox was first brought to the market, its original use was medical treatment, correct?
Yes. So most people think about it for cosmetic use, as you mentioned. It was actually approved for cosmetic use in 2004, but 30 years ago, in 1989, it was actually approved for medical use for excessive blinking, or something called blepharospasm. And we use it for a variety of other uses also now.
Sure, and it does wonders in the aesthetic world. We all know that, but what else is it used for?
So it can be used for chronic migraine headaches, and we'll talk about that a little bit more if you'd like. Patients who've had stroke or have had MS or other problems with their arm or legs where they get stiff and tight. It can be used for excessive salivation, excessive sweating, problems with the neck where people have a wry neck or something called torticollis or dystonia. And it can even be used for bladder spasms.
Wow, I had no idea all of those uses, but let's talk about the Botox for headaches.
Sure.
Would it be used if our viewers are out there for just a common tension headache or a more serious migraine?
No, not a typical mild headache. It has to be what's defined as chronic migraine, which is greater than 15 days of headache per month. So these are patients who have a lot of headache days, they're very disabled, and they've been through other treatments that haven't helped, and we end up injecting them on a regular basis to reduce the frequency and the intensity of their headaches.
How often would they get that treatment then?
About every 3 months is the standard.
Okay. And does it simply treat for pain, or does it actually prevent a headache from developing, doctor?
Right. So migraines are genetic. So patients who get migraines are going to get them most of their life until they may hopefully wear off and go away, typically more commonly around menopause for women because they're more common in women. But they can reduce the actual headache frequency as well as the intensity of the headaches.
For those that don't know, might be watching, and that, what exactly is Botox, and is it safe?
So Botox actually is very safe, and like I said, it's been out of the market for 30 years. It actually is a specific chemical that actually inhibits the contraction of the muscle, and if we give patients a little, it relaxes the muscle, reduces pain, and patients can't have side effects with any treatment. So bleed or infection are possible because it is an injection. It's highly unlikely to be a problem. If you inject too much in one area, let's say you inject too much in the neck, patients can get a little heavy. If patients for cosmetic use and even for headaches, if they're injected too much in the brow or too low, they can get a little heaviness to the brow. And those are the major side effects that we see.
And you got into a little bit, but how long does the dose last?
So again, for migraine and other therapeutic uses, for the most part, about 3 months. But things like excessive sweating and bladder spasm, it can last 6 to 9 months.
A lot of us think the cosmetic world, you're going to pay out of pocket for it, but in terms of the treatment for medicinal purposes, is it typically covered by insurance?
Sure. There are FDA-approved diagnoses, which are all typically approved by insurance. And of course, there's a co-insurance or co-pay. And then there are things that are not on label, which we do regularly, and those are commonly approved also.
Sure. And when you're assessing a patient, doctor, who would be the ideal candidate for this Botox treatment?
So for headaches and per se, it'd be a patient who has enough headache days, so commonly it's most days of the week, who is disabled from those headaches. They've been through more than one medication, typically at least 2, and they just haven't received enough benefit, and they may need Botox for that condition.
Now, you're an expert in this field, and you've actually written a book. Now, talk to us a little bit about that.
Well, we see a lot of patients with neck pain also. We use Botox as well as other treatments for neck pain. There are a lot of non-surgical options, which Botox obviously is, for patients who have head and neck pain as a consideration.
To get started, the initial consultation is the first step.
Correct.
What does that entail for a patient?
So the same as any other medical consultation, the patient comes in and usually, I'm a headache specialist and a neurologist, and so it's preferable that patients see somebody who has enough experience in headache, and that would be typically a neurologist. Not always, but typically there's some other doctors that have headache experience also. A patient fills out a regular form, but they also fill out a form about their head or neck pain and very detailed questions about when their headaches are occurring, how frequent, what part of the head they're occurring in, other triggers that tend to cause their headaches.
Sure. So if anyone they can reach out to you, then the website is orthoneuro.com to set up that initial consultation. Thanks so much for joining us, Dr. Taylor.
I appreciate it.